Hello and welcome to Chronic Pain Conversations. My name is Sharifa McLaren and this is my lovely co-host, Kalila Bruzwell. This is a live show where we have open and honest dialogue about chronic pain. We share experiences, a vast variety of chronic pain diagnosis, look at ways to manage chronic pain in order to give this community support to let you know that you're not alone. So to start our show, we always do a check-in. So, Kalila, what is your pain level at for the day? And is it pain or pleasure?
Hi, guys. It's your girl, Kalila. I'm actually both. So, as you know, I'm on my way back. I've been back in Canada for just over a week. My body is still dealing with a lot of different issues that I'm having. But the good side about it is that I am actually, my book got published this week. And so I actually got it physically done. And on top of that, we have the fact that we're creating new programs and new workshops, both as the overcomer and for people that don't know, Sharifa and I are both on the Fibro Fighters team. And so Fibro Fighters nonprofit. And so we're putting out some surveys out there. So we're going to put it up at the end of the show so that you can find out the details. But we would love for our audience to fill this out because as you can see, we're here to support the chronic pain community and we want to be able to support you, but we need your feedback. So I'm both pain and pleasure and smiling. Tell me, how were you doing today?
Well, I'm pleasure, but I'm even more pleasure because you didn't tell me about this book. So I am totally surprised like everybody else. I'm so excited.
It's okay. It's okay.
I had a really good weekend and my week started off awesome. I actually got to run some errands this morning. So I am like an 8-9 today.
Okay.
Yeah.
You're an 8-9 today?
Yeah, for pleasure. I'm on the scale.
Oh,
I'm up there.
You're up. So what happened? Tell me what happened.
I just feel so good.
Okay.
My body feels good. I had an eventful weekend, but it worked out and I'm excited for today's show. So that's just why I'm up there too. Cool.
Okay. Well, let's talk about today's show. Today's show is about knee pain. Did you know that there is an estimate of 37% of Canadians aged 20 and older who have been diagnosed with arthritis? Of these, 12 experience pain in their hips, 29 in their knees, and another 29 in both. So today we are going to go and talk about the different types of knee conditions and how they develop. We're going to do a quick review on the acute and chronic diagnosis because I think sometimes people get that confused, which I sometimes do. And if you've been watching our flyer, you know that we have a special guest on today, Kelvin Kublall. So, of course, we're going to end as we always do with the question of the week. If you had knee pain, how did it start and did it go away? So are you guys ready to start? Let's go. Okay, so first thoughts, Sharifa, What do you think of knee pain when you hear it? Have you ever had it? What are your thoughts?
Okay, so my thoughts, I grew up thinking that knee pain was only for the elderly. And because I only grew up seeing my grandma go through it, only my grandma. And it's not until I grew older and I started having health issues, I realized that this ain't just an elderly thing because I'm looking at my age and I'm just like, I know I'm not up there. So this is definitely not just for old people. It can happen to everybody. Yeah. And I still get it. It's not like a one-time thing. I get it on and off.
Wow. Okay. So for me, I've actually had to go in to see what's going on with my knee. One of another many things that I've been through in my life. So I've had to go and see if I have the osteoporosis. I've had to go and talk to people. We've had an issue with regards to my weight. So I've had to been losing weight because it takes an effect on the cartilage. So this is something that I'm also familiar with. This is kind of very scary that every week I can associate with one of the topics. It's not good, people, but I'm still smiling. So I kind of know a little bit, but I didn't know the stuff that we researched to get ready
Yeah,
for this.
that was interesting.
So I'm really excited. Okay. Let's talk about the different types. So first of all, in our research audience, we found out that there were 4 pretty much areas that can get affected. So there's what's called the anterior, which is the front of the knee.
Mhm.
Then you've got the posterior, which is the back of the knee. Then you've got the medial, which is inside of the knee. And then you've got the lateral, which is outside of the knee. So
Right.
there's all these 4 different places in which, you can be affected with knee pain.
Right. And then along with that, the different causes for that can vary. So it can be injuries. It could be dislocation. It could be bone tumors. Funny enough, Kalila, I didn't know that there could be a tumor in your bone.
I didn't know that either.
So that was interesting. And then there's different types of arthritis, which I think is very common. Arthritis is the most common when it comes to knee pain. But then there's different types. So we have osteoarthritis.
Okay.
We have post-traumatic arthritis.
Okay.
We have rheumatoid arthritis. And let me tell you, rheumatoid is not fun because that's the one that I suffer with. There's gout.
Wait.
And then you touched on some of the other problems, which was excess weight, lack of muscle flexibility or strength. It could be a previous injury that, comes up again due to other things. Certain sports can cause it, like basketball, jumps, pivots, running, jogging, and then certain occupations. So construction, farming, things that you may, have to stand up long or whatever the case is. So there's a lot of different ways to accumulate knee pain.
Wow. Okay. Yeah. So there's different ways of accumulating it, but then there's different diagnoses, right?
Yeah. So there's 2 diagnoses. There's acute and then there's chronic.
So acute is what most people kind of think of. You break your knee or whatever, and they're just like, oh, you just have a knee injury and it's like, it'll go away. Acute always means go away. But chronic is where it's long standing.
Long term, exactly.
Okay.
And then acute people can remember it as being like immediate.
Oh.
Right. So, for example, you have like meniscal injuries. So that's due to overuse. So often a piece of the meniscus, which is like a piece of cartilage that provides cushion between your like thigh bone and your shin bone, that little thing that, that.
I'm listening.
It will tear off and just float in your knee joint. So that's what a meniscal injury is. Then you have your knee dislocation, which is the lower leg becomes completely displaced with the upper leg. So that displacement stretches and frequently tears not only the ligaments of the knee, but also the artery and nerves.
So basically you're telling me that when they say, well, I've had my knee dislocated before, but you didn't
know what was going on.
You
didn't know what that really meant.
I didn't know what that
meant. But
meant.
then there's also, people can confuse the two with knee dislocation and dislocated kneecap. So dislocated kneecap is a common injury by directed trauma of forceful straightening of the leg, such as like it happens when you like serve in volleyball or tennis when your leg is straight, like it's straight and then like it's forced.
That might because I used to play volleyball.
Yeah,
give me a couple of explanations.
The good Lord kept me. And then you have other ones like sprains and torn ligaments, which is your ACL and PCL, which is the most common, and then tendon ruptures, which is common as well.
Wow.
So that's those are your acute injuries.
Wow. Okay, so let's talk about chronic, which is more the long-term one. So there's this is the word that we hear a lot, is osteoarthritis. So there's knee osteoarthritis. Again, you guys, we're just starting this. We're learning how to say some of these words. Degeneration of cartilage in the knee. So the cartilage is it's going away, and it's this is the meniscus will be completely eroded. So there's stuff in your body that's just going away, and then the femur will rub on the tibia, which means there's that bone action. That's never fun. You've got
imagining it. Can you just imagine it?
No, because I feel it sometimes, and this is what we're trying to avoid with me. So there's rheumatoid arthritis, which is the connective tissue disease.
Yeah.
And that's kind of, it's really, it's hard to think of, like, you don't think of a disease being in your knee. So this is what's really interesting. And this is why we want to bring attention to, and the fact that it's chronic, right? Because it's a disease. There's things like jumper's knees where we think of the tendonitis, the inflammation of the tendon, right? And there's something that I've never heard before. So I'd really love to know if any of our audience members deal with this. Osgood Schlatter disease.
Wow.
Schlatter disease. It occurs in adolescent athletes, where repetitive extension of the knee causes inflammation and injury in the tibia. So it says the bone protrudes at the top of the shin, just below the kneecap. So here we have, like, think about this. We're sitting here as adults, and our parents used to send us into sports all the time. But while we thought we were taking care of our body, we could actually be damaging it.
Yep.
It blows my mind at the fact that there are things that are out there, and, you know, it's literally, okay, it could be working for you, but it could be really working against you.
Yeah.
That's scary for me. Okay, so I'm interested to definitely hear about what's going on, because we've talked about a couple of different things, and now we've got this guest speaker, and I'm so excited to, like, have him on. Can you do us a favor, and can you please give us an intro to this gentleman?
No problem. So our guest speaker today is Kelvin Kublall. Kelvin has always been very athletic and a highly competitive person, applying himself to every sport he tried, ranging from soccer, football, basketball, volleyball, floor hockey, track and field, ultimate frisbee, and many others. He was offered a $26K athletic scholarship after graduating high school, playing 4 years of university soccer and 1 year basketball at Birmingham University. Kelvin was the Berman Athlete of the Year 2016 and soccer MVP in the same year. In 2016, Kelvin sustained a knee injury, tearing his ACL, MCL, and PCL on his right knee. After having successful surgery in 2017, he rehabbed extensively for a year, but never felt the same. Eventually, he started playing sports again in early 2019 after feeling more confident. But late in the year, he torn the left knee, ACL, and meniscus. He has again soon. Through the process, Kelvin has gone through over $10,000 in physiotherapy treatments, chiropractic, and massage. The pain has been unbearable at times. I remember thinking I'd rather die than go through this a second time. Today, he is here to share his story and experiences about going through this painful experience. So we welcome Kelvin Kublall.
Hi, welcome, Kelvin.
Welcome. We're so excited
here.
So we're going to ask you to just share your story, share your feelings, what has been going on, and where are you at today with everything?
Yeah. Hey, everybody. So thanks for the introduction, by the way. Just to, I guess, make one slight correction, tens of thousands
Sorry.
of dollars. So if I could put all the money together, man, it's more than a year's salary, I would say. But yeah, nonetheless, thanks for having me. I'm excited to share the story. Like the introduction said, I guess, I've grown up to be a very athletic person. Athletic sports has been a huge part of my life because something that I was drawn to. I think naturally I was just drawn to it, and it took me away from certain distractions, and I really like to focus my energy on these sports. And I started playing at a very young age. After coming to Canada and then going off to school, I got a scholarship, praise God, and it kind of helped me pay my way through school. However, like you all mentioned, little did I know that playing these sports, the damage it was actually doing to my body. I saw myself as invincible. I thought I could participate in like an Ironman challenge, but I just played sports like every single day. At school, we were training. Soccer 2 hours, basketball another 2 hours, and then we're in the weight room for maybe another 2 hours. So 6 hours a day plus of training does take some toll on your body. And for me, what happened was after graduating university, while at university, I experienced some knee pains, the slight acute ones, the little hyperextensions, and some slight pain, some locking of the knee, some clicking of the knee, pain that I would apply like light remedies to, heat and ice, and eventually it would get better. But after I graduated in 2016 and I came home, I actually went to a camp and I was running in the field without stretching. That's a huge part. No stretching, just thinking I'm still invincible, young and invincible, foolishly running. And I changed direction really fast while wearing some cleats, and I tore my ACL, MCL, and the PCL in the right knee. So the entire knee was blown out. I was kind of hopeful when it happened that it wasn't anything too bad, because I saw myself as invincible. Like, I can't get injured. I've gone through these moments before, but this one was different. Instantly, I dropped to the floor, called to the attention of the nurses and the aide, and was rushed to the hospital because my knee, I could not move. I was in a lot of pain, excruciating pain I've never felt before in my life. Later on, I found out that I tore all the ligaments in my knee, and that I'm going to be required to have surgery if I ever want to return to sports again. So that I waited around and had surgery eventually the following year in 2017. And it was a really tough time in my life, really, because having surgery, your body changes, your mindset changes. You go through a lot of, I want to say it was kind of a depressive time, because I wasn't able to be who I was naturally, which is an athlete. And then I rehabbed the knee, took some time to get back. And then eventually I got back to playing sports in 2019 more comfortably. Your confidence plays a factor in this, because after you've injured once, you don't want to re-injure. So you're kind of like less active. You're very cautious. Anybody that jumped in front of me, I would see an injury happen. And I came back to playing sports. Eventually, that same summer, I was training again and tore the left knee, which is actually a very common thing to do when you tear your knee or ligaments in your knee as an athlete. So I tore the left knee. It was ACL and meniscus. The meniscus is the cartilage between the femur and tibia that literally it's like cushion between the two bones so they don't rub. And when your meniscus gets torn, it's actually very, very painful, because you feel it every single movement, every single bend of the knee. And so I had surgery last year in 2019, November. And I've been rehabbing it since. And so 2020 actually became a year of rehab successfully, simply because I've gone through it one time before, and I was really scared about going through it again. A second time is really damaging, but mentally. But I was able to pull through, push through, and I praise God for what He did in my life, because in that year of healing, I tried to do everything right. Since then, I've changed a lot about my life, my lifestyle, my habits, and even my treatments, because I don't want to ever experience a knee injury again. So that's a little part of my story, I guess. Yeah.
So tell us, what kind of treatments, medications did you have to use, or are you still using?
Okay. Immediately after injury, and just to share with everyone who's listening, I guess, knee injuries can look different for everybody. I'm more of the athlete, so the reason why I sustained this type of injury to this extent is because of the type of activity I was doing. But a knee injury can happen to somebody simply by walking downstairs, by getting out of bed. You can get out of bed and hyperextend. And a hyperextension is where you have your knee go straight locked, but then your body weight goes over top. And that's the most common one. That happens a lot. Yeah,
it hurts.
It hurts. It does hurt. Especially if the muscles in your legs are not strong enough to withstand your body's weight. So when Kalila was mentioning what she was experiencing, I knew right away that was probably a hyperextension. And then it actually stems from the patella. So the pain is in the patella. You talked about Osgood, the Osgood-Schlatter's disease. I think I experienced that when I was playing basketball in high school. They also call it shooter's knee or jumper's knee, where the patella actually protrudes through your.
Okay, so here's the question: you have had, you've had the surgery. Does this mean that you are still considered chronic pain with your knee? Is it still a possibility? Is it still like, I know that you say you never want to have it again. I never want it to be in another car accident again, but does this mean that like when you get older, because you're still young, are you still prone to other things? Like, is this something that you always have to keep in check no matter what?
Absolutely. Absolutely. The reason why I got re-injured the second time around is because I focused on the right knee rehab and not so much my left. That literally the balance and the compensation for your body can do a lot of damage. I'm prone to arthritis, which I believe I already have. The whole theory of when the weather gets a certain way and the storm's about to come, I feel that. Yep. I begin rubbing my knee. Even like right now.
Welcome to the club.
We were like that yesterday.
Welcome to the club.
Yeah, I'm rubbing my knee. And these stuff happened when I was 22 years old. So I was in that myth that, only older folks experience knee pains, like my grandma, my grandpa, those guys. And they always complain about it. But I never seen my parents experience pain like this before. But here I am at 22 years saying, God, this cannot be happening.
Yep.
You're prone,
overly active.
Yeah. It's because I was too overly active and not taking care of my body enough. Some of the pain now that I experience is the occasional, if I wake up and my body is just having a bad day, maybe it's just tight, then I'm not going to be walking or running or moving anywhere. I'm not going to be training or doing anything because I just do not have the energy in my legs to do it. I have to take probably an hour or two to really just stretch or mobilize. And so one of the things that I do first when I get to the gym or when I start to exercise is sit on the bike and just get the rotations in as best as I can.
Can I jump in here for a minute? Because you're talking and honest to goodness, I think you were a fibro fighter or you were like, like these are conversations that we have with the chronic pain community all the time. And it's really funny because you're sitting here and we're talking about your knee, but your knee is what gets you to move. So if you're like us and you're having a hot problem, it can take me an hour or two to get moving. Yeah. And one of the things that I have to do is the same way is get on the elliptical. And it just, and
sometimes the elliptical won't even still help you out. Like your body's just shot regardless of how you try.
But it's a very interesting thing because I never thought about it. With us doing chronic pain conversations, with us really getting in depth into the different types, you're bringing like so much knowledge to me right now at the fact that your day can't start because if your knees are feeling it, you're like, where am I going? No, like, really.
Yeah, absolutely.
Where am I going?
Yeah, it's this is difficult to kind of explain to folks who have seen you active and then all of a sudden you're no longer able to do that. And so for me, what I experienced was I was pastoring during this time and, folks weren't really understanding that I can't just get up and go anymore. I was getting up at, if I had to get up and respond to something early in the morning, instantly there, get up, shower quick, jump up out the house. But all of a sudden that changes. So your routine changes, your lifestyle changes, your experience changes, and then the way you approach things change as well. And so the best thing I learned to do through my process of healing is to actually take care of myself. And we don't actually do that. I know I wasn't doing that. That's the reason why those injuries were caused. But to really, it's not being selfish with yourself. It's not being selfish with your care. It's really just taking care of yourself. And an older man once told me, when I left him, I went to visit him by his bedside. He was in the hospital. And he told me after I left, he says, Pastor, take care. I said, yeah. He's like, no. Listen to my words and actually do it. He's like, take care or you'll end up like me right here. And, I walked away thinking he's so right. We don't actually take care of ourselves. We don't do the steps and take the steps to actually be healthy, be better and heal. We actually think that we can apply some medicine. So you asked me about the treatments and whatnot. When I first had surgery, I did, they gave you the medicine, the Percocets or whatever, the oxycodone. And I had probably like 2 or 3 pills of those in the beginning because it was really painful. But then I told myself, I don't want to go through that. I'd rather to experience the pain than to take those pain medications, which necessarily wasn't the smartest thing because the pain was a lot. You cry yourself to sleep some nights. But afterwards, I started doing the whole changing the way I eat, my diet, and just using different types of treatments like ice and heat and whatnot. And since then, I've had physio and chiro and different osteo treatments as well.
Okay. So we want to thank you so much for having us. We want to go, you like actually gave us a lot of, we didn't even actually have to ask you questions because you went into the treatment and things like that. One of the things that we do is we have the question of the week. So I want to see if we've gotten any responses. Ms. Sharifa and Kelvin, do you want to take that from us?
So our question of the week this week is, if you have ever had knee pain, how did it start and did it go away? So some responses were that Tanya, I want to say that's the name, lower back and above her buttocks area, and it's extremely painful. I don't know if it went away. I don't think it went away, but I know the lower back pains, that's not fun. Because sometimes it's like you can't sit, but neither can you stand up either. So it's like, what do? Do I just keep walking around?
Yeah. I learned eventually that if you experience some knee pains as well, your hip gets displaced, your lower back gets displaced, and it goes up your spine to your neck. And that's something I experienced last year.
Wow.
So I would say they're all really, your body's really connected in that way.
Oh, wow. Well, I know that my pain never goes away. It's on and off. And like Kelvin, he's joined the club. I can tell y'all when it's going to rain or snow or whatever the case is.
Wow. Okay. Let's move on to our keep it moving moment. Is that okay?
No problem. Go ahead.
Awesome. Okay. So our keep it moving moment is actually coming from someone in the background. You've heard us call her name before. She's the one that's producing it right now. Miss Kanisha's back there. So give her an applause. Okay. So she came up with this keep it moving moment for you guys. And it says, one who conquers the sea today is ready to conquer the ocean tomorrow. And this was taken from Matshona Del Wayo. And I think that this was really powerful in terms of, you know, as we're talking right now, especially what Kublall was saying, like learning how to take care of our body, right? Like we're trying to go on to other things, but if we learn how to take care of our body, like really focus, one of the great things, as much as it's chronic pain, it's been a blessing to me because I've learned how to listen and to take care of my body. And once I learn how to take care of my body, I can take care of my business. I can take care of my family. I can take care of all the other things that it is that needs to happen with my life. So again, one who conquers the sea today is ready to conquer the ocean tomorrow. That's our
I absolutely love that. I love that. So we're going to wrap up the show. I personally, like I told you guys, I grew up thinking, just like Kelvin, that, you know, knee pain was only dealt with by elderly people. But as my life changed, I realized I was totally wrong. And it can happen to anyone. And no matter how healthy you believe you are, it can happen to you. But the important thing is that you get the right treatment and you find the correct way to manage it, whatever that might be.
Awesome. And I'm actually going to give my closing space to Kelvin because I'd like to know, is there anything that you want to say to our audience in just a few words? What would you say to anyone with knee pain out there?
I would say, well, first off, you guys are doing a great thing here by educating yourself. So if you're going through some type of knee pain, take the time to figure out what's going on. If it means go see a doctor, ask them, tell them, let them know. We do these self-diagnosis sometimes with Google, but it's not the best. I would suggest that you get to a professional and check it out because something very slight can be something very major in the long run. And you might have tears that you actually, and small tendon tears that you don't know about, but they will accumulate over time or build up and cause you more pain. So get it checked out, definitely.
Thank you.
Nice. We want to thank you for joining us for another episode of Chronic Pain Conversations. We'd like to thank you once again, Kelvin, for joining us today. You can follow him on Instagram at Kelvin Kublall. And we will be back next week discussing depression and mental health. Be sure to follow us on Facebook, YouTube, Twitch, and Instagram at CP Conversations. If you are a chronic pain sufferer who would like to share your story, we invite you to be our guest by visiting the bio link in our social media platforms. Have a blessed day, and remember, Chronic Pain Conversations is a show that enlightens and advocates about chronic pain.